Welcome to Yellow Nurses. Today, we are sharing something that all nurses and nursing students should know. The World Health Organization, WHO, has released its first ever global guideline to help improve pregnancy care for women with sickle cell disease. This is big news in the world of healthcare. First, let's talk about sickle cell disease. Sickle cell disease is a group of blood disorders. In this condition, red blood cells become sickle-shaped, like a crescent moon. These cells don't move easily through blood vessels. That can cause pain, anemia, infections, and even organ damage. Her body needs more oxygen and nutrients. This puts extra pressure on her blood and organs. As a result, she has a 4 to 11 times higher chance of dying during pregnancy than women without the disease. There are also risks for the baby, like stillbirth, early birth, or low birth weight. That's why WHO created this guideline. It gives doctors and nurses over 20 important recommendations to manage sickle cell disease during pregnancy. Let's look at the key points. First point. Folic acid supplementation. High-dose folic acid to support red blood cell formation. Second point. Iron supplementation. Iron recommended only if iron deficiency is confirmed, especially in malaria endemic regions. Third point. Malaria prophylaxis, adapt supplementation and malaria prevention care based on local endemic status. Fourth point. Pain crisis management, early recognition and treatment using safe analgesics and fluid management. Fifth point. Safe pain relief, ensure availability of pain relief protocols appropriate for pregnancy. Sixth. Infection prevention, routine vaccinations, ague, pneumococcal, influenza, and antibiotics as indicated. Seventh point. Thrombosis prevention, screening and preventive measures for blood clots during and after childbirth. 8. Prophylactic blood transfusions, scheduled transfusions for high-risk women to reduce maternal, fetal complications. 9th. Blood transfusion safety. Ensure blood is cross-matched and antigen-matched, with infection screening. 10th. Enhanced antenatal monitoring. Frequent checkups with maternal and fetal assessments, ultrasound, growth scans. 11th. Preconception counseling. Discuss pregnancy timing and risks with women planning pregnancy. 12th. Contraception access. Offer reliable contraception to help prevent unplanned high-risk pregnancies. 13th. Respectful, person-centered care. Ensure individualized plans that honor women's preferences and dignity. 14th. Stigma reduction. Reduce discrimination and negative attitudes within healthcare settings. 15th. Early care discussion. Encourage women to engage with knowledgeable providers early, ideally pre-pregnancy. 16th. Multidisciplinary teams. Include hematologists, obstetricians, midwives, pediatricians, and blood specialists. 17th. Childbirth or postpartum planning. Ensure delivery in facilities prepared for high-risk births and neonatal care. 18th. Inter-pregnancy care. Address complications and optimize health between pregnancies. 19th. Data collection or audit. Track outcomes and service delivery to improve future care. 20th. Research or investment. Call for more studies on sickle cell disease treatments during pregnancy and increased funding. The guideline also talks about giving respectful and personalized care. Women with sickle cell disease should not face discrimination. They should be able to talk to their doctor early and plan their care in a safe, informed way. Taking care of a pregnant woman with sickle cell disease needs a full team: doctors, midwives, pediatricians, and blood specialists like hematologists. Sickle cell disease is growing across the world. With the right care, women with sickle cell disease can have safe and healthy pregnancies. This is just the beginning. WHO is planning more guidelines for managing diseases like diabetes, heart conditions, and mental health in pregnancy. Thank you for watching Yellow Nurses. Like, share, and follow us for more important updates in nursing and healthcare.